So my name is Whittney LaCroix, and I'm the Chief Nursing Officer for Tribal Health. I am a member of the Rosebud Sioux Tribe. I grew up on the reservation, spent most of my life here. My family obviously is from here. My mother was a nurse. That was very important to me. I wanted to emulate her. She was very caring, giving, active in the community, and I remember just thinking, I want to be like her when I grow up. So it was always part of my journey that I was going to be a nurse and I was going to give back to my community. When I was in nursing school, I received the Indian Health Service scholarship that helped me pay and get through college as a young single mother. So at some point in time, I knew I had to come back to the reservation to pay back my time. So the best place for me to do that obviously was in Rosebud, where I'm from. So I very reluctantly came home, and I told myself when I came back that I was going to be here for 2 years, and then I was going to move back east and work at a bigger healthcare system. But once I got here, obviously I fell in love with what I did and became very passionate. As Native people, the decisions that we make revolve around our family and our community. And when I came back, it was very apparent to me that is very much part of who I am, and it drives the decisions that I make every single day. So I'm not just a nurse. It's not just a title for me. It's not just a job. It's something that I am and I do 24/7 all the time. So when I came here and came back, it was very clear to me that there was a huge gap in the care and the services, or a huge difference, I should say, in the care that was provided at the facility that I had just come from. This huge health system, thriving, all these wonderful resources, this beautiful building, and then coming home and seeing the care that my people got, it was infuriating and it was sad, and it drove me, and it made it so important for me to make it a priority to show people, to show the world what was happening in Indian country in regards to healthcare. So I think what differentiates tribal health is that we listen, and that's something that we talk about often as a leadership team, is that we have to listen to these communities. Too often, I have seen people come and go in our community that have what I call the savior syndrome, that I'm going to go in and I'm going to save the Indians and I have all the answers. And the truth is, we can save ourselves. We don't need anybody to come in and save us. We are resilient people. We are strong. We're intelligent. We're gifted. We have a beautiful culture. We don't need you to save us, but we do need you to help bring your expertise. We need help with resources. So I think the difference with us is we don't have the savior mentality. We are coming in here and we're going to support you and we're going to help you because we already know that you have the answers. We're just there to complement them. I think transforming Indigenous healthcare is possible. I don't think that there is a one answer solution to that. I think it's going to take multiple people coming together, working together to address this problem. So we need people who want to come here that don't have the savior mentality. And I think heart, for me, from my perspective as a nurse, as a community member, as a tribal member, as a patient who receives care in this healthcare system, I need somebody who's going to come with compassion, that's going to come with heart, that's going to listen and be understanding, and who's going to dedicate themselves to really trying to understand and tackle the healthcare problems that our people face. People need to understand or be open-minded about the fact that this is a beautiful place to be, and it's a beautiful culture, and you will have an amazing experience if you choose to work with tribal health.